Hi there, I'm Dr. Susie Houston. I am a provider at the ECU Health Lifestyle Medicine Clinic, and I'm here to talk about lifestyle medicine and our March diabetes check in. And so this is scheduled for today, which hits March 13th. So happy Monday once again. Just a little bit about me, and I know my little head is over there in the way, but a little bit about me. I am a DNP, Doctor of Nursing Practice, and this will seem a little bit like alphabet soup, but I just want to be clear of who I am and what I can do to help our community and those patients that are interested in seeing me to help with them and manage some of their lifestyle medicine changes and chronic conditions. So, DNP, Doctor of Nursing Practice, that's me. I have been a DNP for about a year and a half now, almost 2 years, and time flies, doesn't it? And the concentration I'm in is a AGNP, Adult Gerontology Nurse Practitioner, and then I'm also a CDCES, Certified Diabetes Care and Education Specialist. So I've been that for almost 17 years. I've got a BSN, Bachelor of Science in Nursing, and both my DNP and BSN I got at ECU. I never knew ECU existed till I moved to America, and I never thought I'd ever be a pirate, but go Pirates. And I am a registered nurse, and that's from Canada. I'm a certified chef, and I'm also a person with diabetes and also OOFD, just in case you didn't know, owner of 4 dogs. And I'm a CLIA, Canadian living in America. So that's me in a nutshell. And then here we go as we move into diabetes prevention and management at ECU Health Lifestyle Medicine Clinic. So we have you covered because we've got two worlds here. We've got the lifestyle medicine approach, which is really trying to help people work on changes, small daily changes that turn into habits that form for good, healthy relationships in their world that may impact sleep. Improving your sleep can help. Avoiding risky substances, smoking, alcohol, sweet drinks. Maybe it's sweet pastries. Maybe it is, um, your regular soda drinking habits. Also, healthy eating, physical activity, managing your stress or keeping it a low level or manageable, and also developing and forming and maintaining relationships. All of those work together as a whole to help build a foundation for a wellness house for you to have the best approach to dealing with and managing chronic conditions. Now, diabetes is one thing I like to help people manage and prevent and live with so it doesn't manage them. And on the left hand side, you'll see the American Diabetes Association's self care behaviors, and that involves main front and center is healthy coping, like how we live with and manage things, really has an impact on how well our chronic conditions can be managed. It also includes healthy eating habits, being active, taking medications, and it's not just taking them, it's understanding what you're taking, why you're taking it, when you should be taking it, and all those things lead into, oh, am I taking enough or too much medications, especially if I started working on my lifestyle medicine habits, which are on the right hand side. That could be a game changer for decreasing the dose or number of medications you take. Monitoring, that's really important because we need to monitor certain things like our weight, our blood pressure, our blood sugar, our heart rate. Things like that play into whether you need certain doses of medications or not. Also, reducing risks are important self care behaviors and problem solving. Because where we are today, we didn't just get here magically. It was with work and sweat and tears and all those things in between that help. So we have you covered from both sides, the lifestyle medicine component and also the diabetes self-care behavior approach, along with preventing type 2 diabetes. So I think that's really important of what we have to offer here at the ECU Health Lifestyle Medicine Clinic. So, March, we have got 31 days to a healthier diet. Not my favorite word, diet. Most of you, if you know me, that is just that's one word that I'm not a fan of. But healthier eating habits, healthier eating plan. It's something we want to be sustainable. Whenever we use that word diet, the reason I don't like it so much is most of us have come across a lot of so-called diets in our time, and there's more coming up every day. Every time you grab your phone to look at something else, something pops up at the side to kind of prompt you or trigger you to be thinking about something different than you even grabbed your phone for in the first place. And then you will end up coming my way and then be expressing, oh, what about this diet? And as soon as I hear that word, my shoulders go up kind of thing. And not that I'm in a defensive mode, but I'm just like, oh, tell me more about what you've read about. Because usually there's a cost involved and there's usually several restrictions. So we're going to talk about March as 31 days to a healthier nutritional approach or healthier food approach, meal planning. And for March 13th, which is today, it's that whole idea of sodium or salt intake. So it's making sure that we are paying attention to canned foods, frozen foods, and even fast foods. It doesn't say that on this Spark People calendar, but fast foods, as soon as you leave your house, guess what goes up? Some people's their blood pressure, but also it could be related to the sodium. So as soon as you go out and if you haven't had breakfast or lunch and you've had to, because we're all in a rush, you've headed through a fast food establishment, chances are you've doubled or tripled your sodium intake for the day. And if you do not have high blood pressure or been told you should be on a restriction, the idea would be that you would take in less than 2,300 milligrams of salt on a day-to-day basis. If you do have high blood pressure, it should be less than 1,500 milligrams of salt. And so 2,300 milligrams of salt, if you thought about it, is about 1 teaspoon of salt. And it doesn't matter whether it is pink Himalayan salt or white table salt, salt is salt. So the next time you're thinking about, oh, why is my blood pressure so high when I went to see my provider the other day? What did you eat the night before? Is that what's impacted your blood pressure? So it's something for you to think about. Here we go. So with the ECU Health Lifestyle Medicine Clinic, diabetes and pre-diabetes work really well together. Just we like to help manage diabetes, but we also like to help people prevent diabetes if they can. So when you think about concepts such as food as medicine or exercise as medicine, you need to tie those together to that they could help improve your mood, your weight, your blood pressure, your blood sugar, cholesterol, joint pain. Food is medicine, that concept. If you thought about when you go to the grocery store, what's on your list? Is this wise medicine or not so wise medicine? Am I down all the aisles picking all the processed foods up, putting them in the cart? Because that's our usual thing. That's usually what we always have at our house. Have you ever thought, oh, I need to make a game change and maybe I've got to try different foods? Maybe I've got to focus on shopping like a farmer. That's the one I like. So if you shop like a farmer, would you be down the aisles with all the crinkly packages and wrappings and things, or triple wrapped? It's in a box, it's in a bag, and then it's individually. Those are processed foods. Are the foods that I have, the most of them at home, are they easy to fix in the microwave? Are they really quick and fast? Like you've got your own fast food in the house, in the cupboards, or in the freezer. So those are not going to be your best medicine if we're working on food as medicine. So if you thought about shopping like a farmer, that would be the perimeter of the store. So you go into the right, usually the stores I shop in, like a Food Lion or even Walmart, I think it's like that. So you go to the right, usually you got to go through the deli. Be careful of the pastry section, kind of jump over it if you can, or go quickly by, kind of put blinders on if you have to. And then you're in the produce section. Usually you got loads of room because nobody is there with you. That's where you're going to have food as medicine. So that's going to be the fruits, the vegetables. And in the vegetable category, we've got the starchy veggies and we've got the non-starchy veggies. Some are going to cost you more in carbohydrate budget land. Also, you got to think about these foods that are there, they're about as whole as you can get. Whole foods. That means it's as close to it fell off the tree, you picked it out of the garden or the soil, than if you were a farmer and you went and did and got your own produce out there in your backyard or your field. So that's as close for as city slickers as you could get. Food is medicine because that is going to be in the produce section. You've also got in that section, you got the limes, the lemons, the herbs that you can use to help make things taste nice. Then you got the back section, and that is the meat section. And so that'd be like shopping like a farmer. So And in our concept with lifestyle medicine, we are looking towards whole plant-based foods. So we would want you to stay more in the produce section if you can, but you might not be there yet. So you might still be eating some animal proteins. And so you want to go to the back of that store like you're a farmer again. And same with the dairy section, which is still the outskirts of the store. And that's got the least amount of impact with processing. Exercise is medicine. If it was you were going to start moving more, that can help. Again, your weight, your mood, your blood pressure, your blood sugar, cholesterol, joint pain. So think about it. All those things I've just mentioned, people take medications for those. But if you could use activity or exercise as a medicine, it could help warm up and tone muscles so that your body is more efficient to manage the foods that go in, put the sugars where they need to go, and just in general, be an efficient machine. So, what great medications? And the thing is, the side effects are to a minimum compared to if you go to the pharmacy for a medication after you've got a prescription from your provider, you're not even sure if it's going to be covered. There's usually going to be a copay. And then you've got a big long list of things you've got to think about of that medication. And if you read every single thing, you might want to leave it at the pharmacy because of all the side effects that go with it or the potential that could go with that. So, with food as medicine and exercise as medicine, the the side effects that go with it are pretty well all good. I mean, you improve your mood, you could improve your weight, your blood pressure, your blood sugar, cholesterol, and imagine if your joints didn't hurt as bad and that you just felt better. So on our team, we've got providers, we've got registered dietitians, lifestyle coaches, exercise physiologists, counselors, and we have classes that we've got going. And then just at the beginning of the month, we had our open house here. So we had lunch with the doc and dinner with the doc. And that had, I think, 20 seats open for people to join. And then we got to do a whole food plant based meal, go through the cooking and shopping measures you needed to do. And then we got to sit down and enjoy a nice power bowl with some baked tofu and roasted sweet potatoes. So I will always be sharing those when we've got our next sessions coming up, and they're free. You just need to go and sign up and make sure you've got a seat saved for you. And then, if you find out about it, definitely share it because it's always nice when you come together and you've got people that you can share ideas with making changes, especially if it's in your household. So I want to remind you that March is National Nutrition Month, and the theme for this year is Fuel for the Future. Fuel, because we want good things going in, just like food as medicine. Imagine if food could be fuel for our body. Sounds awesome because that would be things that we're picking up at the grocery store, right? Not necessarily. I always look when I'm coming to work, the restaurants and things that we have around the hospital system, they aren't in the best interest of our health. I often think to some of my patients or say to some of my patients that I think those restaurants are trying to help the hospital stay in business, but don't tell anyone I said that. Just be thinking, buyer beware next time it's time for eating lunch or breakfast, or maybe you rethink how you plan your morning so that you're not in a mad rush and you got to wait in line. And think about it, the cost of gas is not cheap. So fuel for the future could be less time in the fast food line as you're waiting to place an order. So think about that next time you're there to place an order. I sometimes turn my car off and I hope it's going to start again just because I wanted to save a little bit of gas. But that's just me. For those that know me, know that I'm a little on the cheap side, so I always like to save some money, but I also like to spread that sharing of the savings. So with the fuel of the future, it's raising awareness about the importance of making informed food choices. You're in charge of what you decide you're going to buy and spend your money on, and if it's going to be a wise choice or not so wise, and if it's going to work towards your food as a medicine plan for you and your family. Of course, we want everyone in a family setting to be eating the same meal so that we're not having to prepare special. And there is nothing special about a diabetes plan. There is no diabetes diet. It's just using foods and knowing where the carbs are and where they aren't, and how you can budget your carbohydrates for your meals and for your snacks and have them spread out through the day so you don't have big highs and lows in blood sugars. Also, we want for the fuel of the future, developing healthy eating and physical activity habits. We know those two are really important. Adopting healthy lifestyles through a variety of nutritious foods and practicing portion and engaging in physical activity is really important. Now, with week 2, it is talking about for the fuel of the future, National Nutrition Month. See a registered dietitian. So, for you, those of you out there listening, when is the last time you've seen a dietitian, or have you ever? If you were trying to make some wise decisions and choices about your nutritional intake, and then you thought you needed a little bit of guidance, maybe today's the day that you contact your provider's office or you contact our office and find out how you get connected with one of our registered dietitians here. They can help you build a nutritious plan for your eating habits, your meal habits, and snacking to help with weight loss, help with your blood pressure management, diabetes management, and cholesterol, and just make you in general feel better. If it is your weight you're concerned about, now might be the time to make some slight changes and have a registered dietitian on your team and work toward your health goals. So, also to think about the diabetes prevention program's been going on for many years now, and most people don't know it's even available. So, this is a year-long program, and it's geared for people that have got pre-diabetes, not type 2 diabetes, but the step before you get to type 2 diabetes. So, it is there are in-person classes and there are virtual classes. You can get a referral. Hopefully, more and more primary care providers are knowing this is available and they are suggesting it to their patients, but that doesn't always happen. So it might be you hear about this diabetes prevention program and you want to find out how you can enroll or find out if you're eligible, and then you want to find out where they are. So in some cases, it's you call and find out, or I'm going to direct you to a website where you can find out more information. But you could always call our clinic, and I'm just going to repeat our number a few times through this session, and that's 252-847-9908. And we can always help you get connected to where there are some programs going on, whether it's in Pitt County or whether it's somewhere within North Carolina to help you out. And the idea is we're working on lifestyle changes, teeny tiny ones that can lead to great big rewards, especially as far as decreasing an A1C, which is a sugar average, and helping people increase their physical activity, which we know is important. And the big one of the goals is losing 4 to 7% of your body weight and decreasing that A1C. So 1 out of 3 Americans is at risk or has prediabetes. And if they don't make any changes in 5 years, it's pretty well guaranteed that they are headed towards type 2 diabetes, which could be prevented. So that's why the diabetes prevention programs across the country, they're big deals. It's a big, big deal. And it's a free cost. The only cost to you is your time. So that time would be 1 hour spent weekly for 16 weeks, then 1 hour of time every other week for 2 months, and then 1 hour of your time for the remaining part of the year, which is I think about 4 months, so 4 1 hour sessions. So all in all, there's 26 classes, so that's 26 hours out of your year to help you stop, prevent, or delay type 2 diabetes. So 26 hours versus a lifetime seems very tiny, and these are only tiny changes and things to help you work on with habits. Okay. And then with prediabetes, when you think about the statistics, the risk of having a shark attack is 1 in 11.5 million. Okay. So that's quite a big number. But the risk of prediabetes is 1 in 3. So if you're sitting or you work with like 5 people, 6 people, then 2 out of you in that 6 are at risk for prediabetes. So there's a website, doihaveprediabetes.org, to take the quiz, find out more information. And even if you typed in diabetes prevention, you're going to find some information, okay? Here is 3 ways that you could be eligible. An elevated A1C. A1C is a sugar average. So if your A1C is in the orange zone, pre-diabetes, 5.7 to 6.4. So that's a number to remember. Of course, if you're below 5.7, good for you. That means no diabetes, okay? So keep it up. Whatever it is you're doing, or maybe you've got to think of, oh, I've got diabetes in my family. I need to step up my game. Maybe I need to see a dietitian. Maybe I need to think about my eating habits. Maybe I've got to start walking like I thought I was going to do at the beginning of the year. Hello, it's March, right? We are 3 months into the new year. So no time like the present if you got to restarted on your New Year's resolution, right? The other way is gestational diabetes. So if you have ever been pregnant and were told you had diabetes while you were pregnant, that puts you at risk for type 2 diabetes and it puts you eligible for the diabetes prevention program. The other is you complete a pre-diabetes risk test, and that's coming up. So you can, if you've got 5 fingers held up when the test is over, that puts you at risk for pre-diabetes, and that puts you eligible for our programs that we have. So here is 7 questions, and it talks about your age. So if you're younger than 40, 0 points. If you're 40 to 49, that's 1 point. 50 to 59, that's 2 points. And 60 plus, you get 3 points. Okay. If you're a man, you get a point. If you're a lady, 0. So, yay for the ladies. If you were pregnant and had diabetes, that's gestational diabetes, you do get a point. If you have a mother, father, sister, brother, you get a point. And if you've ever been diagnosed with high blood pressure or your blood pressure is creeping up, you get a point. And if you are physically active, you get 0 points. So keep moving. But if you're not physically active, you get a point. Then there's the weight. So it's a sensitive, touchy subject. I know that because we all want to lose weight. So, depending, if you've been told that you're overweight, you get a point. If you've been told you're very overweight, you get 2 points. And if you've been told you're obese, you get 3 points. So that's based on height and weight, and they give you a score if you can see on that. So if it is you have met the criteria, you may want to contact and type into a search diabetesfreenc.com, and that's going to help you find a diabetes prevention program across the state of North Carolina. Some may be virtual and some may be in person. So it just depends what's going on in your area. Also, there's great information on the CDC website for diabetes, loads of information to help us manage and prevent things. So, just as a reminder, ECU Health Lifestyle Medicine Clinic, we've got one on one providers in addition to your primary care. So, people come to see me if they need help preventing diabetes or managing their diabetes or their weight. And that's in addition to their primary care. So it can help from that angle. We've got registered dietitians. We have lifestyle coaches that are nurses and lifestyle coaches that are exercise physiologists. We have a program called Exercises Medicine, which is a great way to get started if you're kind of stalling about, or you're feeling a little not ready to start an exercise program. That might be what's for you. We also will have in the future, as we've started, the cooking demonstrations and group classes. So call us to find out what we have coming up, 252-847-9908. And then this is just a reminder, your health and well-being is really important. And with the lifestyle medicine, these are the pillars of health. So imagine we're trying to help you build a wellness house with a roof that's going to stay on, but we need really good, strong pillars. And those pillars, think about, how is my healthful eating? Could I improve that a little bit? Is my pillar a little wobbly? It might need your attention. So maybe it's you get connected with your primary care. Maybe you get a consult with the registered dietitian. Maybe you even have a visit with one of the providers at our clinic. If physical activity, you haven't been moving much, you're a bit of a couch potato, that might be a wobbly pillar. It's going to be hard for the wellness roof to stay on. So that'll be a tough one. But maybe it is, oh, I'm going to start moving something. Okay. Stress level. So imagine if your stress level's high, that could be some trouble for going on internal damage gets done. We have cortisol levels, they rise, they make us resistant to losing weight, make it hard to drop the pounds on the scale. Also, it can just be turmoil inside our body that's trying to quietly, silently help us. Some people don't realize the stress level they had until they might have had a heart attack or a stroke. because the level just got so bad, and internally our cells were fighting away over things, and blood pressure was going up, cholesterol was going up, weight was going up, diabetes came along, and then it was like a tsunami of chronic things going on that led to an event. The relationships that we've got, it could be in our family, could be in our home, our extended family, could be our community. There might be things going on that we need some guidance. And in some cases, we might need a counselor or a therapist on our team. Because remember, we want all these pillars, all six, to be good and strong so that the wellness house or roof fits on really good and stays for any kind of storm in eastern North Carolina. So this is just a little reminder. We do have a free Sweet Talk and monthly diabetes support chat. Right now it's in person, and we'll be having our next one for March. It's March 15th, so that's on Wednesday. And we meet for in person from 12. It's about a half an hour, so we don't. If you can get here by 12, you will be good to go. And it's at the ECU Health Lifestyle Medicine Clinic, which is at 2610 Stantonsburg Road, which is our wellness center. And some people might know us from when we used to be called ViQuest. Well, we are now the ECU Health Wellness Center, and it's at 2610 Stantonsburg Road. And March 15th, we'll be having an in-person diabetes support chat, and that goes from 12:15 to 12:45. So it's a little check-in, a little touch base, share some information, and learn a little bit about why carbohydrates matter. Also, now this is cut off a little bit, but you can see that the Winning with Diabetes, and we've got it as a boot camp because there's so much to know about managing diabetes. But we have a program coming up, and it's Saturday, March 25th. It goes from 8:30 in the morning to 3 in the afternoon. And we are extending the deadline, but we would love people to register by the 17th so that we can secure a seat for you. Space is limited. And you can either call 252-847-4149. You could scan that barcode if you can see it. Or give our clinic a call, 252-847-9908. So this Winning with Diabetes program has been going on, gosh, about 20 years, if not a teeny bit more. And it's a day-long event with speakers in the morning. Lunch is provided. We talk about carbohydrates to help you with your game plan. And then we've got screenings in the afternoon. So it's well worth the $10, which includes lunch. And experts will be around from the local areas to help you out. If you or someone you know has diabetes or you want to learn more to manage it, please make sure you contact me so I can keep you on my email list, or call our front desk and they can let me know to add you to that, okay, to share information on a monthly basis. Don't forget just to stay hydrated. I know it's a little chilly out today. Our winter's dragging on, but our body really needs water 24/7, 365 days of the year. So all the seasons we need to stay well hydrated. So what a great way to not have to worry about carbohydrates in your drink. Should be zero carbohydrates in your water. And then that means you get to enjoy the carbohydrates, you get to chew those. So that means you get to enjoy your food and make sure all your drinks are zero carbohydrates. But look at all the great benefits of drinking water and why I'm a huge promoter of water. Help you lose weight, healthy skin, fight infection, get rid of junk. Help your heart out. We want to keep your heart healthy and working well. Less joint pains, boost your energy, prevent constipation, reduce your risks of cancer, and feel better. So what an awesome drink to be having in your cup or in your bottle. So until next time, I'm Dr. Susie Houston. I am from ECU Health Lifestyle Medicine Clinic. Thanks so much for joining, and I apologize for that, but our main number, if you have any questions or you needed some assistance with your chronic conditions to manage or prevent, give us a call, 252-847-9908. Thank you. Bye.